Hello. Welcome to my channel, GGNP Health Information. Today, another day, another great video regarding a job in the healthcare sector or healthcare related jobs that is only requires an associate degree, that is 2 years education background in healthcare. Today, how are you doing? Hopefully you guys are doing well today, whoever is tuning in to get this great information. Um, Today, the topic is radiation therapist. The radiation therapist, uh, today, the topic is what type of job is it? Where do they work? So, radiation therapist is a technical job in the healthcare sector and only needs a 2 years college, which is associate degree. And radiation therapist is the definition of it is radiation therapist. People who graduated with associate degree in radiation therapist, they operate the machine uh, that delivers radiation to people with cancer. So as you everybody is aware of it, that the people are living longer and cancer is now more relatively common, especially with aging population and also others. So now the technology to treat cancer also is developing, and there is jobs also opening related to oncology. Means the medicine, the part of medicine that treats cancer calls oncology. So radiation therapy is part of that. Radiation therapists, they only need 2 years of education, and they work the educational the background of the education, what kind of class they have to take, what is the criteria. Well, it's going to be on the next show, but today we're going to talk about what is radiation therapist. Radiation therapists are people who graduated with associate degree in radiation therapy, and they work with physicians who treat cancer patients, uh, and also nursing, oncology nurse and nursing, and also other who work with the oncologist, the physician oncologist, uh, like auxiliary staff. That includes medical physicists. Those are the doctors who are specifically prepared in oncology. Their education background is in oncology, and also oncology nurses, as I said, and also medical decimetrists. Those are that they prepare the radiation amount for any given cancer tumor. So radiation therapists are specifically manage the machine that you guys have seen, like on a CT scan, on an MRI, but different. This is a machine that delivers radiation to a cancer tumor. So these people works with at a clinic, on a hospital, and also specialty research specialty clinic as well, like a physician operated or physicians managed clinic, hospital, and also in a research clinic or research lab. So the radiation therapists are very important people because they are the one, the dermatologists or the oncology physicians, they order the radiation. Those are expert in oncology, and then the radiation therapist actually manage or operate the machine that delivers the radiation. So what they need to know is that where the tumor is based on the doctor's order, and also how to position the patient um, to deliver that radiation, also how to protect the patient and also themselves, because they can be exposed to radiation. So this is a job that now is more apparent. I wasn't even aware of it before, but it's coming up more and more because of the prevalence of cancer nowadays. So the radiation therapists are very essential part of the team to manage, to calibrate the machine that delivers the radiation, and also look after the machine and see if there is any abnormality with the machine that they operate, and also quality control of the machine. And also they work with the patient very closely. They're the one who is going to situate it, and they're the one who is going to reassure the patient and educate the patient what is happening in at any given time when patients are receiving radiation therapy. So they have to have knowledge about tumors and spots on the body, and how to position the radiation in order to provide the specific uh, tumor, and also work closely with the oncology physician, the oncology nurse, and also other auxiliary staff. So they directly receive their order from the physician who is leading the treatment. And also the education part for the patient is also a big part, reassurance. And so people has to be people's person, good communicator, compassionate. And because we all understand that cancer is a terminal, uh, cancer is a devastating diagnosis in many cases, and the radiation therapy is either a cure or to shrink a tumor. So radiation therapists know and understand that, and make sure that the patient are protected from unnecessary radiating exposure, and also themselves. So radiation therapist I found is very, very interesting position in the healthcare sector, that I think if high school graduate, and also people who went for a different type of education, like a graduate college from with something that they can actually go back, get a 2 years associate degree in radiation therapy, and work uh, in hospitals, in physician managed clinics, or research facilities. So it sounds very interesting job. And the next time that I'm going to bring you is going to be what kind of education is needed to be a radiation therapist, and also how long does it take, and the other one is the salary, how much do they make, and what is the job prospect of radiation therapist. And that is going to be, and today my program is very short, and I am going to see you or at the next program. That will be, like I said, it's going to be how long is the education, and what kind of education do they need, what is the background, and also what is the salary. Thank you.